Assalamualaikum warahmatullahi wabarakatuh and good day to judges, participants and audience. The title of my research is Haptoglobin as a potential biomarker to predict coronary artery disease (CAD) in young adults with hypertension and prehypertension. Currently, coronary artery disease, which most commonly present as acute myocardial infarction (AMI) in young adults, is increasing in trend. One of the contributing factors for early development of CAD is the higher prevalence of prehypertension and hypertension among young adults. Blood pressure management in young adults is challenging due to the traditional risk factors inadequately predict coronary artery disease. Using Framingham CVD risk score tool, for example, the young age is considered as a protective factor. It leads to the underestimation of CAD prediction and also inaccuracy. Therefore, identification of new CAD biomarkers in young prehypertensive and hypertensive adults is necessary to improve blood pressure management in this age group. Eventually, we need to improve risk stratification to predict CAD in young prehypertensive and hypertensive adults to prevent development of immature CAD at this cohort. This study is part of a bigger research project in which in our preliminary study, we already identified haptoglobin as a potential biomarker in young adults with acute myocardial infarction by proteomic analysis. Meanwhile, for this study, we aim to measure the concentration of haptoglobin in normotensive as control, prehypertensive, hypertensive AMI to see the role of haptoglobin level as a potential predictor of MI in hypertensive and prehypertensive young adults. Secondly, we would like to determine the association of AMI and haptoglobin level in prehypertensive and hypertensive group. This study implemented a comparative cross-sectional study design. We recruited male young adults aged 45 years and below. For control, we recruited healthy individuals with blood pressure less than 120 for systolic and 80 for diastolic. For prehypertensive group, the blood pressure was defined as between 120 to 139 systolic and between 80 to 89 for diastolic. Meanwhile, for hypertensive group, the blood pressure is 140 and above for systolic and 90 and above for diastolic. AMI patients were recruited in the emergency department of HTAA Kuantan. Patient presented with acute myocardial infarction. The numbers of subjects for each group was 40, making a total number of our subjects was 160. Blood was collected from all subjects, and the blood samples underwent a ELISA analysis to measure the haptoglobin level concentration in individual sample. This table shows us the CVD risk factor profiles in all groups. From this table, we can see that hypertensive group presented with the highest mean waist circumference, highest BMI, and also highest percentage of obesity. Hypertensive subject also presented with the highest total cholesterol level as compared to the other groups. The level of haptoglobin also significantly higher in AMI patients when compared not only to the control but also prehypertensive and hypertensive group with the p-value of less than 0.05. And when we proceed with multinomial logistic regression, there is a significant association between AMI event and haptoglobin level in prehypertensive group with the p-value of 0.002 and also hypertensive group with the p-value of 0.017. These results indicates that haptoglobin has the capacity as a predictor of AMI in young adults. Haptoglobin is an acute phase reactant protein. Previously, Wang et al. has shown that strong correlation between haptoglobin levels and also Jansseni score. So it's actually consistent with our study that Jansseni score refers to the severity or describe the severity or level of development of atherosclerosis. And we know that atherosclerosis may contribute to the pathophysiology of CVD, including prehypertensive and hypertension. And as atherosclerosis also associated with inflammation, the increased level of haptoglobin in our prehypertensive and hypertensive subject, as shown in our study, is consistent with the increasing number of component of metabolic syndrome that present in our subjects. As we could see, hypertensive group presented with the highest total cholesterol level, the highest BMI, and also waist circumference. Our findings suggest that inflammation reaction may have more substantial role in development of prehypertension and hypertension in young adults, that consistent with the increased level of haptoglobin. As a conclusion, we conclude that there is a significant association between haptoglobin level in prehypertensive and hypertensive young adults. So we suggest that we conclude that haptoglobin is a potential predictor of CAD in young prehypertensive and hypertensive subjects. Haptoglobin could discriminate those with higher risk to develop CAD in this cohort. For recommendation, we recommend this study to be conducted in larger sample size to validate the results and to evaluate the role of haptoglobin as a potential predictor of CAD in this cohort. Thank you for your attention.